So, so I'd like to introduce Dr. Paul Byers, who will give us a quick overview of the current status.
Absolutely. So as y'all know, now we've identified our first case of COVID-19 in Mississippi. This is not unexpected. We have expanded our surveillance now for quite some time to be able to identify our first case in the state. We are actively identifying potential contacts at this point to make sure that we take appropriate actions to protect the public health based on their level of contact and their level of risk. But again, you know, we are going to continue to monitor. We're going to continue to look for cases. This case was identified in Forest County. And was just identified yesterday.
So I'll go ahead and kind of pick it up from here. So again, we do have our first case from Forest County, adult male with recent travel to Florida. Other things just to keep in mind, Governor Reeves has been closely in touch with us and aware of all the situations and has been well integrated into the decision process, as has been his team. Also, would like to really appreciate Lieutenant Governor Hosemann and Speaker Gunn and all the legislative leaders have been very engaged. Really greatly appreciate y'all's support. Several other things we do need to talk about. Just an overview of the coronavirus and give us some real perspective about what it is. So coronavirus, or COVID-19, is a novel coronavirus. It causes a flu-like symptoms. Most of the illnesses are relatively mild, although it does cause severe illness in some people, particularly older people and people with chronic underlying medical conditions are at high risk for bad outcomes. So that's something to consider. It doesn't seem that children are much affected, thankfully, and most people with coronavirus or COVID-19 will make a full recovery. Only a small proportion, less than 1%, are likely to have severe outcomes or death. There is no antiviral treatment for COVID-19 at this time. There is no vaccine, although one is in development. We do have testing at the State Department of Health lab, and to obtain testing, a physician needs to submit it to us, and we can get results back typically within 36 to 48 hours, if not less, depending on what time in the morning that we get it. So we do have it available. The testing is already available through commercial labs. In addition to our first presumptive case of COVID-19, we have several other significant announcements that we would like to make. First of all, the Department of Health is expanding access and making it easier for physicians and providers to order the COVID-19 test. The Department of Health is recommending more expansive long-term care visitor recommendations, and I'll go into that in a second. We are making recommendations about limiting mass gatherings, and as part of that, in consultation with the leadership, we are recommending limiting visitors to the state capitol, and we'll be talking about other government buildings in the near future. As far as access to testing, we are streamlining access to testing. Although testing has been available throughout Mississippi thus far with physician-to-physician communication, we're going to do away with that step, and they can just order it and send it, and we'll run it. Also, keep in mind that COVID-19 testing can be performed at commercial labs. So LabCorp and other laboratories have come online where you can order it just like you would any other lab. Testing for COVID-19 does not mean the patient has COVID-19. We have a lot of other respiratory illnesses, viruses, infections running around. Even now, the vast majority of people who are having symptoms of respiratory infection are not going to be COVID-19. So if people have this, please do not be too concerned. Just call your physician. Please call them ahead of time, because it's better to let them know that they can see you and take appropriate precautions, and then do appropriate assessment, and if needed, COVID-19 testing. The other thing, which is very appropriate not only for COVID-19 but for any illness, if you're sick, stay away from gatherings, stay away from work, don't go to school. Even if you don't have COVID-19, you need to make sure we don't spread other things to other people. Now, transitioning to our conversation about long-term care visitor recommendations, MSDH recommends that all long-term care facilities, personal care homes, and group care sites for those with disabilities take the following actions to restrict visitors. This includes discontinuing social activities, consider restricting visitation of this manner until further notice, keep signs that discourage all non-essential visitation, and definitely prohibit anyone who's ill from entering the facility. Keep all ill visitors away for at least 48 hours after symptoms resolve. Consider limiting visitors' visitation by children, and also postpone any group visits that might come and bring several people into the facility. Visitors should practice proper hand hygiene and cough hygiene. Make sure that the facility has plenty of hand sanitizer and soap and water. Visitors should visit only their family. Get in and get out. Don't dawdle. Don't want to expose other folks. It's also unclear how long these recommendations will be in place or if they will be escalated.
I hear nothing.
Now, we are making additional recommendations about mass gatherings. To prevent dissemination of COVID-19 in the community, the Department of Health recommends that individuals, communities, and organizations take the following steps. No, I'm good. To prevent illness outbreaks.
Excuse me a second. Can you have them mute their phones?
Y'all please make sure that your phones are muted when you're not speaking. Please mute your phones.
We have heard the honest presentation.
We haven't been able to hear anything.
It's not muted, is it? It's green.
No, it's not muted.
We may have to circle back on that one. All right,
Yes,
we've
now
got
it's
to
not
keep
muted.
going.
Go ahead.
All right, to prevent illness in those most vulnerable, we recommend that anyone over 65 or with complicated medical conditions avoid any gathering of more than 250 people. That's going to be an individual choice that people need to take on their own. We are also strongly recommending organizations or groups having mass events of more than 250 strongly consider canceling. If there are concerns or if there's special circumstances that may dictate that it should be continued, we recommend you call our hotline so that we can give you guidance on ways to mitigate it or to discuss different options. Everyone needs to take precautions at mass gatherings, even of smaller numbers, and make sure we use those appropriate hand hygiene and cough etiquette measures that you would normally do. Social distancing is also something that we need to consider. For schools, the Department of Health is recommending canceling, delaying any mass gatherings over 250 similar, also to cancel any group assemblies that are not necessary or unessential. Consider restrictions of athletic events or arrange it in such a way that there are not large mass gatherings of students or other individuals. But there is no indication to necessarily close schools at this time. We do not have any intent of giving any recommendations to close schools right now. Department of Corrections. In consultation with the Department of Corrections and the Office of the Governor, effective immediately, the Department of Corrections is temporarily suspending visitation at all facilities in which MDOC inmates reside. This is in order to establish sanitation and prevention protocols to prevent the introduction or the transmission of COVID-19 within these facilities. This is a precautionary measure to protect staff, inmates, volunteers, and visitors from potential exposure to the virus. Attorneys and essential visitors will be allowed at the facility, and the visiting area will be sanitized upon completion of each visit. Additional parameters will be determined as protocols are established. MDOC is reinforcing common health practices based on preventive measures recommended by the Department of Health and CDC. At this time, I would like to turn it over to Director Michelle from MEMA.
Thank you, Dr. Dobbs. The Mississippi Emergency Management Agency and the Mississippi Department of Health continue to work very closely together under Dr. Dobbs' leadership. I want to commend him for his leadership and his work on this COVID response. Today, every emergency support function and our partners in this COVID response are working through the pandemic annex plan today. The purpose of that is just to identify any limitations, constraints, or gaps that currently exist in the plan and develop solutions there. There were none and have not been any identified, but we want to make sure that we are on top of this and ready to respond as we need to. The State Emergency Operations Center will be activated to a level 1. The State Emergency Operations Center has not been activated at a level 1 since Katrina. It's important to note that the reason for that level of activation is not indicative of anything else other than we want to make sure we properly focus and posture all of our support and partner agency in order to respond as we may need to do. Dr. Dobbs will make recommendations after the next 24, 48 hours about adjusting that level down to the appropriate level for maintaining this response throughout the duration of it. Other than that, we continue to support Dr. Dobbs. Emergency Support Function 8 is the lead agency in this COVID response, and we're prepared to respond and support them in any way necessary.
Thank you, Director. At this time, we'll take questions in the room.
I have a question as far as if someone, finds themselves being self-quarantined, what does that look like? What should they be doing in their homes when they're, self-quarantining themselves?
Well, and it depends on whether, we're trying to isolate or quarantine an individual who may have been in contact but is not having any symptoms versus somebody that we identify as a case. And so, if you isolate someone at their house because they're symptomatic and we're concerned about them being a case, obviously the thing that we want to do is to limit household exposures. We want to keep them in a part of their home or their residence where they will not be in contact with other individuals. If they do have to have contact with those individuals, they're instructed to wear a mask. We know that in particular, household contacts may be very vulnerable to infection from known cases. So we want to ensure that we take the proper precautions to not only protect those individuals who may be in the household, but also to make sure that that person who is ill stays at home so that we can limit further transmission.
And should people be worried about traveling through airports and, other states? Should they be worried?
Well, and it depends a lot on what an individual's risk level is, too. Certainly, if there's not much transmission in your area and you are at higher risk for complications and you're going to an area where there's known transmission, you should exercise caution. Either not go or make sure that if you do go, that you're taking the proper precautions to keep yourself separated from large groups, that you're using hand sanitizer. But certainly those recommendations are going to evolve. And I think it's important for everyone to stay aware of what's going on in the United States, where there are areas where there may be ongoing transmission, and to take those travel precautions accordingly. We may get to a time when we're seeing transmission more broadly. And, we know that exposure in travel could be a potential risk.
Can you give us precise?
Let's go to Ross, because he's tried to get
Can you tell us more about the individual who has been identified with the virus? Was he an older adult? And about the number of people that he's come in contact with? Have you tested those folks?
So that's a great question. This is an adult. This is not an individual who was hospitalized, and so we're grateful for that. This individual is currently under home isolation, and we are monitoring this individual every day to make sure that they're staying as well as they can be under the circumstances. He is an adult, but he's not over the age of 65, if that's what you're asking, that would place them in that higher risk category.
And what about the folks that he's come in contact? You mentioned something earlier about you were trying to identify the folks that he may have come in contact with. Right,
and so we've made identification of a very, very small number of individuals that were at contact, and we have some of those folks under home isolation or home quarantine as a result of their contact.
Just a follow-up, he was traveled to Florida, right? Is this travel related or community based, the infection, you believe?
So, certainly there was travel to Florida in the time that could indicate that transmission occurred there, but remember that the incubation period is up to 14 days. We would like to say for sure that it was travel associated because we know that there was travel But again, the incubation period is outside of that window as well.
Was it determined how he got in contact with that? Was it on a plane? Have you all talked with people from Florida regarding him?
There is no known direct contact to a confirmed case in this individual.
Could you give us a direct list of things that someone who feels they may have been exposed or infected should do as of now to seek testing, isolate themselves, and protect public health?
Yeah, sure. So there's several things in there. First off, if someone is ill and they're worried that they could have COVID-19, you need to call your doctor or provider, let them take care of you and order the testing as appropriate. So in general, travelers are not going to be at especially high risk unless you've been to an area of a lot of transmission. So people who are traveling, across the state lines and stuff, just because you traveled doesn't mean you need to quarantine yourself, right? So that's not an indication. And even if you've traveled and you're a healthcare provider, unless you have some other indication that you are exposed, we would not restrict them from working. Now, if you have been exposed to someone who's known COVID-19, that's a different scenario. If someone is a known exposure to COVID-19, then we would put them on quarantine and do direct active monitoring to make sure that they do not get ill.
Dr. Dobbs, are you at all concerned about schools as relates to students being on spring break and then coming back to the school system?
Of course, we're somewhat concerned about it and are taking these measures. It's very difficult to know. The average person is not going to be at risk, and we're going to take some of these social mitigation sort of strategies to sort of limit the number of people who might come in contact with one another. We'll watch this very closely. Certainly, if it's indicated in an area to close a school, it's certainly something we will do. The situation with children is a little bit different in the sense that their risk profile for bad outcomes is very different than it is, say, for a nursing home or other areas like that. So we're being obviously more aggressive in protecting the vulnerable population.
While elderly and the suppressed immune systems are more susceptible to complications of COVID-19, are they also more likely to contract the virus?
There's no reason to believe that they would be more likely to contract it. I can't say that we know that for sure, but it would be assumed that, there's no pre-existing immunity to speak of that we're aware of. So everyone should be at pretty equal risk of contracting the disease. Just the manifestation of symptoms are probably more severe.
Now, if someone calls their primary care provider, because I've received calls from people who say, I'm alone, I'm sick, and I've called my primary care provider and they don't know where to get this test. Is that access expanding now? And if you call your primary care provider, will they know how to get tested?
That's a good question. It is available, right? So there are thousands of doctors and thousands of nurse practitioners and PAs in the state. So we can't assure that everyone is going to do something, but the testing is absolutely available, both through the Department of Health lab, absolutely available through the private labs, as mentioned before. There are some procedural processes you have to do as far as like collection and storage and shipping, and those are just normal things you have to deal with. But if a clinic, hospital wants to send a sample, they are perfectly able to get it to us or to the private labs.
Dr. Dobbs, are you concerned about people overloading the emergency rooms who fear they might have the virus?
Please don't visit the emergency room unless it's an emergency, right? Emergency rooms are for emergencies. And if you're ill and worried, please, call your clinic. Go ahead and make a forward call. Let them help triage you and figure out what to do with you. The emergency room is the exact wrong place for these folks to go. If you do have COVID-19, we want to make sure that you get the appropriate care quickly and not go into a scenario where you're having to wait in a waiting room for hours and exposing other individuals and not getting the personalized care that you deserve.
Dr. Dobbs, is the department monitoring people in North Mississippi that might have had contact with the patient in Shelby County?
We are.
How many are you looking at?
We're looking at 2 individuals now, and they are symptom-free.
Just 2?
Yes.
We heard something earlier about limiting visits to the state capitol. Can somebody elaborate on that?
We, Speaker and I have been visiting about that today. We anticipate Dr. Dobbs will give us some indication on how we should proceed. Those will include, for example, we have things in the rotunda, every day downstairs. I think those will probably cease during this period. And we'll look for Dr. Dobbs to give us other indications on limitations coming in and out of the Capitol. We intend for the legislature to continue to work. They're at work today, and the Speaker and I are going back down there in a minute, and we continue the people's business throughout this process. the speaker.
So have you made a definite decision that you will limit visits?
That is the recommendation of Dr. Dobbs, that obviously he just said 250 people. It was kind of a threshold. We got 250 people in there every day just working. So when you add school children who visit and you add people from other states who've been traveling all across the country, we have lots of visitors from other states, it could become a breeding ground. So I think it is wise simply for the protection of the public that they not be in a place where there's a large collection of people who have come from a lot of different places. It just serves to spread, increase the chances, I guess, of the spread. And so his recommendation, we think that's a wise approach. We'll continue to work on what that looks like, I guess.
Are you looking at shutting down any facilities like the two museums, which have a tremendous number of people? Even if you can limit it to 250, that's just one class in some cases.
Each state agency is going to be advised by Dr. Dobbs on actions to be taken. The institutions of higher learning will be meeting on theirs. Each one of these will be given recommendations from Dr. Dobbs and his staff, and I assume that they're all going to follow those. And so those will all be in transit as we go through the next few days. This is about protecting vulnerable people that live in Mississippi. Dr. Dobbs was very clear with us and the speaker about that. We are about protecting people who may have a very adverse outcome if these steps are not taken. So I know the speaker and I and Dr. Dobbs are all, and the governor, I've just talked to the governor about an hour ago. We're all of the same mind. We're all working together on the same program, which is to protect our vulnerable Mississippians going forward. And we're going to follow the advice of our physicians.
Dr. Dobbs, can you elaborate on the physical process of what happens with the tests after they're taken and how to administer?
Yeah, Paul, if you want to talk about that.
Absolutely. So, we have published guidelines for all physicians in the state on how to collect the samples, and so they collect the samples at the clinic level, and then those are packaged, and we have a system throughout the state where in any county a sample that a provider collects to submit to the public health department can be transported directly by courier to the public health lab, where it's processed and run, and we get results out pretty quickly.
You said 36 to 48 hours, is that right?
It depends on certainly the number of tests that we're running. Right now, though, we're getting results out in a matter of just a few hours after the sample comes to our lab. Obviously, there may be some delay in transit time. But as soon as it hits our door, we're working and processing those samples on a daily basis. So we have a daily run that's going on now.
How many tests have there been so far?
How many?
42. We've had 42 tests. We can run 200 a day, and we have capacity for 1,000 patients at this time. And we're getting additional supplies as time evolves that we can do even more tests. We do not see at this moment any bottleneck from our lab running tests.
What's your recommendation to parents that have children who have health issues like asthma and heart problems?
They do have chronic conditions and would follow certainly those mask guidelines. Certainly would be very conscientious about protecting them, hand hygiene, and watching them closely. We do not have any recommendations about not going to school or anything at this time, but certainly we just really stay alert on the latest recommendations because this is going to change. This is a fluid situation. It's going to be different next week than it was this week.
Director Michelle, you mentioned that you're raising the Emergency Operations Center to level 1. Can you talk about what functions that will serve, how will y'all be helping out in this effort?
What a level 1 means is that all of the 15 emergency support functions will be physically manned as opposed to having access virtually. And what that will do in this case is bring everybody to the proper posture, gain the proper attention, and then as Dr. Dobbs deems, we will probably go virtual on some of those emergency support functions that Dr. Dobbs deems are not mission critical at the present time. But it is a heightened level of awareness and just keeps everybody focused where they need to be on the respective functions.
Are there, as far as those functions go, is that like helping to get testing out, or is it helping like supply shelter if people need it?
The testing piece is fully on the ESF-8, which is in this case Mississippi Department of Health on the testing. Where we would do is if shelters needed to be, we could help facilitate those. Quarantine shelters are different than shelters we typically use in responding to floods or tornadoes, so we would again act on the advisement of Dr. Dobbs in doing that.
Has the health department done anything in regards to establishing protocol for Camp Shelby, Camp McCain, any of those facilities? Keesler?
We have not established any protocols related to military bases.
Are you aware of whatever protocols they may be taking?
I don't have any current knowledge of what they're doing.
Dr. Dobbs, what would you say to people who may be skeptical, that believe that this has been overblown? Some people may believe the president briefly said that it was a hoax and that public officials are blowing this out of proportion.
Someone asked me what I thought about the mood or the perception of the public, and I said the average is pretty right. It's the spread. So in general, I think we're kind of where we need to be as far as our concern, but some people are too concerned and some people are not concerned enough. If you take it an average, it's a serious event. There are things we need to do. It's going to be disruptive to our daily lives. Most people are going to, if they get it, are going to be fine. Most people are not going to get COVID-19 probably. These are things that we can do to save lives, and we're here to save lives, and especially to protect the vulnerable people. So it is very serious. It is very concerning. This is something that we've been planning for years. We have a 447-page book that outlines who does what in what sequence. And that's what we're going to work on, and that's what's happening right down at the at MEMA right now, revising those plans, and as part of the governor's COVID-19 steering committee, making sure that we have an updated plan, we execute that plan, and prevent deaths. This will prevent deaths. More people are going to get sick. Some people are likely to die. It's unfortunate. We are here to make sure we minimize that impact and also extend it over time such that we don't overwhelm our healthcare system. You know, that's an asset that we need to be very conscientious of, because when people get sick and they have to go to intensive care units, we do have a limited supply of those types of operations.
Any advice for colleges? Students are coming back from spring break all across the world, unlike K through 12. What do you suggest colleges do?
Right now, we're suggesting the same sort of mass gathering prohibitions that we're doing for everyone. Certainly there are, we think it's very important to go ahead and make plans for virtual classes, or what you'd have to do if we didn't have classes. And mass gatherings include classes of 250 or more, right? So we'd like for people to look for options for that. Certainly if colleges or community colleges want to do something more precautionary, we're fine with that. And appreciate their planning efforts. It's certainly not a wrong thing to do. So a lot of it's planning and sort of limiting the big risk, and obviously some of the basic stuff, hand washing, staying home when you're sick. It's hard to overestimate how important those two things are, hand hygiene and staying home when you're sick. We're all really bad about going to work when we're sick. And if we just do that one thing, it'd probably be the most impactful.
With the private lab testing, is the state tracking that the same way, or is that?
It is, yeah.
Yeah, we're working with the private labs for them to be able to report to us the number of tests, and certainly we have now added COVID-19 to our reportable disease list, so the expectation is that any positive at a private or a commercial lab requires an immediate notification to the Department of Health.
What triggered the test? You don't know exactly where he was infected, but what triggered the test? What were the symptoms? What, did he not follow the screening, the normal hospital screening?
He was sick and called his doctor. That was the exact right thing to do. He was a sick individual, was worried, called his clinic. They arranged to treat him in the proper manner, and that just reinforces how important it is. If you're sick and worried, call your clinic, call your provider, call your doctor, and let them take care of you.
I thought hospitals had to follow certain protocols to screen patients.
Anybody can test, if it's appropriate. You mean as far as like risk?
Well, I was just wondering if there's any particular symptoms outside of the normal flu symptoms.
Just like flu, it's indistinguishable. Of all the tests we've done, they had the exact same symptoms, and they were all negative. The vast majority of tests that we're going to continue to get or that people are going to do are not going to be COVID-19. There's a lot of stuff out there. There's other viruses, there's flu and all kind of stuff. So people, just because people have a viral syndrome, it definitely doesn't mean they have COVID, and it probably means it's something else.
But did he request a test? Because you guys have only done 42 tests, right?
He called his clinician, and they made an astute judgment to make a test.
Is that separate from the 42 tests that that we're talking about statewide?
That should be inclusive.
That's included.
That's in that one. Yeah.
Anyone have any other questions? I did want to take a moment to thank all of you for your solid and accurate reporting. Oh, and Dr. Dobbs wants to say one more thing.
Just real quickly, there'll be more changing soon. The governor will be getting back in town tomorrow afternoon. So, be prepared that additional actions may be taken, or, we'll be having additional updates for you guys. This is a rapidly evolving situation. Before we close it off, I would like to offer an opportunity to our state leaders to make any comments. Anything, gentlemen?
No, I'll speak first. Let the speaker speak. Everybody needs to use common sense. This is containable and is minimized by the use of common sense. And our Mississippi people know to wash their hands, report yourself when you're sick. We have one citizen already do exactly the right thing. So we encourage everybody to do exactly the right thing. And we will get through this as a society as we always have. We should anticipate this will be disruptive. It's going to be different for a period of time. And so we will deal with that as we have everything else. Mr. Speaker?
Yeah, I just want to commend Dr. Dobbs and his staff for taking this seriously. As you can tell, this is a very serious situation. We as state leaders are taking it seriously. That's why we're here today. And we want to get the message out to the public as to what to do. It seems to me they have put together a very good plan. I want to commend them for their diligence on this, their hard work on this. We will continue to monitor this. To echo the Lieutenant Governor, people need to be patient. You use common sense, and they just need to be careful. Don't assume that you are impervious. And so we want to get that message out. I think doing that, we will be able to weather this storm and hopefully get past it, and everybody will be okay. But I again want to thank them for what they've done, and we will continue to work, stay on top of this as state leaders. We're going to make sure that we do everything we can to keep the public safe.